Alyson, it's a pleasure to be here with you. So we've got about 15 minutes. I want to jump right in. Modern Health, you guys provide mental health services to employers. You've gotten a whole bunch of backing from some very high profile names in the venture world. Started in 2017 by you. I believe most recently announced a $1.17 billion valuation, which is, I believe, one of the fastest to unicorn status by a female founder and CEO. I believe I read. So congratulations to you on that. And just for everybody who doesn't know about this, and I'll ask Alyson to explain this far more correctly than I will in a little bit. Modern Health provides essentially digital mental health services. They sell them to employers. They provide a suite of potential options that employees can go in and use to help treat and acknowledge mental health. Alyson, just give me the 60-second version of exactly what you guys do. I always rather, the founder and CEO explain this to our audience than me. So walk me through exactly how your service works briefly here.
Thanks, Drew, so much for having me. And I'm Alyson Watson, founder and CEO of Modern Health. And yeah, to go a little bit into what we do. So we are a mental health benefits platform for employers. So we work with employers to make it easier for their employees to get access to mental health resources. And that could be everything from digital content like meditations, maybe an evidence-based course that treats things like depression, could be virtual coaching, could be therapy, could be group sessions. And the way that it works is once we partner with an employer, the employees get access to the product, they download the app, they take a quick assessment to understand where they fall on the mental health spectrum of green to red. So we like to think about mental health on this spectrum from green to red. We all fall somewhere on that spectrum, but it ebbs and flows at different points in our life. I'm sure we're all feeling a little bit closer to the red zone right now, given everything going on in the world. But based on that and based on the registration process, someone then gets a personalized mental health care plan for them. So whether they fall in the red bucket, maybe they get connected to a therapist, or maybe they want to work on mindfulness. So we'll connect them to a coach who can help them with digital content that really helps them improve awareness and mindfulness and being more present. So there's really no one size fits all for mental health. And so we try to make it as easy as possible for as many people to engage and take a much more proactive stance with their mental health overall.
Got it. So, and just to clarify this for people, there are a lot of different kind of digital mental health tools that are out there. You all sell these things to employers in the same way that employers buy other benefits. You don't have a consumer offering, correct? So this is something people are going to get through their jobs.
Yes, that's exactly right. We really think about this as the fourth pillar, right? So you have medical, dental, and vision benefits. And it's actually pretty interesting that medical, dental, and vision benefits didn't always exist. They became something as a way to attract talent, and originally were through government programs, and then all employers started offering them. Well, mental health has become that fourth pillar. So we believe this is here to stay. Every employer is either rolling a mental health benefit out now or will in the next 12 months.
So I want to ask you, I mean, over the course of the pandemic, so many things have gone digital. I mean, here you and I'm talking to you from my attic. I think you're in your dining room. But how has the way people are approaching these services and accessing these services changed kind of during the course of the pandemic? We know there's really, I know we have written about the shortage of mental health services that are available in this country, but how did the pandemic change your business, from the standpoint of where and how people were accessing what you all provide, not just because of the kind of stress demands, but just from the kind of, need for teleservices that we've seen happen kind of across the medical spectrum for digital health?
Yeah, it's a great question. I think the biggest thing is just the appetite to be able to connect to someone virtually. Pre-pandemic, we still saw a large percentage of the population wanting to meet with a therapist or a coach in person. And now, of course, we've seen that shift to completely virtual. And we think that's here to stay. And we think that that's great because it really is a lower barrier to entry, right? For folks who might be working in brick and mortar, they can't exactly leave for an hour in the middle of the day to go see a therapist if they're struggling with depression. So this makes it way easier for people to get connected to care virtually. And just the awareness and the appetite to be willing to meet with someone virtually has skyrocketed since the pandemic.
How much does the in-person versus digital divide matter in the mental health world? I mean, obviously, if I need to go see my orthopedist, but they actually need to be able to take a look at my, my knee or something like that. But for mental health services, I mean, is there a meaningful difference between seeing someone digitally and seeing someone in person?
We've actually seen that it can be equally, if not more effective and impactful seeing someone virtually, just because it's so much easier. They can schedule it. They're more likely to show up. So we've actually seen that it can be just as, if not more effective as going in person.
So I want to ask you, I mean, I've talked to a lot of telehealth companies, right before the pandemic and during the pandemic, and they've all seen these kind of booms in business. But, with these employer, with people who have a kind of sales model like you guys do, where you contract with an employer, one of the things I often see is that, employers say, hey, this benefit is really, really important to us. And look, we've contracted with a company to provide this. And then, after that happens, you actually see very little either, obvious penetration into the employer environment. How do you guys get kind of, once you have your foot in the door with the folks in the benefits or the HR department, how do you get control into making sure that employees are going to actually use this stuff? Because I've been skeptical for a long time in terms of some of the, utilization numbers we saw, early on in the days of telehealth and telemedicine, where people say, this is amazing. We have so many customers, so many clients, we have so many members set up. And then you looked at their utilization numbers and they actually stink. I mean, they're, like 5 out of 100 employees have ever used the product even once. I mean, so talk to me about how you break down the barrier and kind of what those barriers are to making sure that people are actually using, that you're not just selling a benefit to employers that's kind of very popular and trendy and needed to offer right now, but that actually people are benefiting from this.
Yeah, it's a great question, Drew. I think honestly, there's been so much latent demand that we see such high engagement immediately upon launching. So just to give some context there, traditional EAPs see about 1% to 3% utilization, and that's because the user experience is difficult. You have to call some 1-800 number, you're on hold for 2 hours, maybe you eventually get connected to customer support who says they'll call you back and they'll send you a list of therapists, and it's just a terrible user experience, and so engagement was really low. Well, if we streamline that and make it a really great user experience and allow someone to get connected to care, whatever modality of care that is, right? Whether it's coaching, therapy, group, digital, but make it really easy and really fast, well, you're going to see higher engagement. So then the next big thing that impacts engagement is there a stigma around engaging? And we've seen a big cultural shift over the last 2 years as mental health has become more and more destigmatized. And it's really sad, but I do think that the celebrity suicides of Anthony Bourdain and Kate Spade opened up a conversation. People saw these folks as, wait a second, in the eyes of society, these folks are seemingly very successful. We had no idea they were struggling. So way more people started speaking up about their struggles. Famous athletes, more people said, hey, I struggle too. And I might be successful in the eyes of society, but I'm struggling with depression or anxiety. And so this really helped destigmatize mental health over the past few years. And then this pandemic hit and everything else that's happened over the past year in 2020, right? The ongoing racial injustice, the political environment, climate change, people who are home right now in isolation, who have loss of a loved one, have their kids home without childcare. All these things that are impacting people and have to some extent created a level playing field in that everyone struggles. Everyone struggles in some capacity, and maybe the perspective on that struggle is different, but we all are faced with different struggles each and every day. And so that's created a level playing field of people opening up and feeling way more comfortable to say, I'm struggling because of this, or I'm struggling over that, and I want to get support and I want to get help. So when a solution like
Okay, I think we may have briefly lost Alyson here for a second. We'll see if she comes back online in a moment or two. Oh, wait, there we are. Alyson, I think you're back. We lost you for a second there. Can you hear me now? Just give me a hello if we've got you.
Yeah.
Okay, great.
Can you hear me?
All right, well, yes, I can. Okay, I think that's something we've all been dealing with over the last year or two. So I wanted to ask you, I mean, do you think that most companies really care about these issues? And I ask that not to be cynical, but I see some companies say, hey, we really care about mental health. And at the same time, I see plenty of other companies say, hey, we really care about mental health. It's great that you're working 100 hours a week. The barriers between work and home have completely fallen. I mean, what's your sense from the clients that you all have signed up, or even the environment you get when you're talking to people about your business? I mean, are companies truly committed to doing something here? Because I feel like there's some that are and some that are forward thinking, and others that kind of pay lip service to this and that are saying, I mean, I know we had something, we've written a little bit about, some of these incidents over at Goldman Sachs where they've got young employees working 100 hours a week. They feel like they've completely lost their, ability to have any kind of a even semblance of a personal life. And you've got the CEO saying, oh, I saw some junior banker out to lunch, taking a day off. What's that about? So, I mean, give me a sense. I mean, you know this market, you deal with these people. How real is the level of concern kind of beyond the level of lip service that I think we've seen from some folks?
I'm so glad you asked that question because I think it's a really, really important topic. So if we just take a step back here and we look at over the past few years, mental health, even before 2020 started, was the #1 cause of disability worldwide. So before 2020 started, it was already the #1 reason that people were taking a leave of absence from work. And so we were seeing this increase over the last several years. Now, couple that with the way that we work is very different, right? We no longer work 9 to 5 and don't have smartphones or computers next to our bed or, sleep with our cell phones on our nightstand where we're checking our email in the middle of the night or having the overflow of information and what's going on in the news and social media and all these things that are constantly impacting our ability to be resilient to what's going on in the world. And so we are at a point now where mental health issues are increasing so rapidly, and especially with adolescents, which is the future generation of our workforce, that if we don't do something about it, the rate of innovation will decline. And so these employers who are waking up to the fact that the only way to be successful in the long game here is to protect your employees' mental health. Or we will get to a point where, one, employees they will refuse to work at a company that doesn't help and support and protect their mental health. And two, the companies that do not take care of their employees' mental health, the company itself, the business will decline. And so I think we've got, another several years until employers will have no choice. So the examples that you gave where, hey, we're paying lip service, but we're not actually going to make this investment, those companies just will not be able to be competitive. They won't be able to attract and retain talent. And people just won't want to work there. And I really think it starts with the leadership. It comes from the top down of, we believe that in order for this business to thrive, we need a diverse workforce. We need to invest in all of your mental health. And we know that ultimately that's going to increase productivity and going to help us with the long game.
Talk to me. I mean, there are a lot of people playing in the space where you guys are now because there obviously has been a huge demand for this. What do you think the biggest competitive differentiators are for your business versus your peers? Or is this kind of a place right now where there's just a lot of white space, there's a lot of room for everybody because of the, lack of these services previously and the demand for them?
Yeah, it's a great question. So when we started Modern Health, there were a number of other players who had raised a lot more money and who had been around a lot longer. And I actually think that was to our advantage because we were able to see what works and what doesn't, and then build the right solution from the ground up, which I think has been the key to our success. It's been the key to our growth, is building that from the ground up. Once a company gets to a certain stage or size and they've built a product that already has some customers on it, it's really hard to rip that out and start over. So we actually had the benefit of seeing what's going on in the landscape and knowing that the reality is with these companies, timing is everything. And we hit our stride at the right time of really seeing what was working in the landscape, what wasn't, and let's build that from the ground up. Now, what that thing was that we figured out was building a holistic solution that covers that full spectrum. So when people think about mental health, they typically think people in crisis mode, and they think people in the red zone, and they think the way to treat that is through high-cost psychotherapy or medication management. Well, that is a subset of the population. It's about 15 to 20%. But what about the rest of the population that's in the green and yellow? How do we get them to proactively engage in their mental health? How do we prevent them from getting in the red? So building a holistic solution that covers that full spectrum not only can engage a much broader population, but you actually can get all the incentives aligned between the employer and the employee to really proactively take care of people, get them to engage so that they get better and prevent them from getting into the red.
Last question for you. Signing up customers and companies that you're going to use your services, that's one half of this. You also need to sign up providers, mental health providers who are going to do these services. We've seen this kind of shifting medical workforce with the emergence of these digital companies where you have places like, everywhere down the spectrum from, Roe and Hims that have signed up a lot of doctors to do, men's and women's health, other kind of higher up the acuity scale, there are places that have signed up telehealth providers. And you see a kind of generation of physicians that have been very interested in this. What has the sign-up environment been for you all in terms of, your medical workforce being able to attract people in sufficient numbers?
I'll be honest, the bar was abysmally low before starting Modern Health in that when a provider, a therapist, typically works with a health insurance company, they were getting paid, the national average reimbursement rate is $40 to $60 an hour. So imagine you just finished your PhD and you have folks who are willing to pay $250 at point of service, and you have a line out the door for your services. Why would you work with a health insurance company who's paying you barely enough to live in a metropolitan area, $40 to $60 an hour? And remember that therapists don't work a full 40-hour week. They can't just see people back to back for 40 hours. They have to prepare for those sessions. They have the follow-up. And so they're limited by the number of hours they actually can charge per week. So basically what we did is we said, we will actually pay you, rates that your own rates that are competitive. And not only that, we'll build technology that makes it way easier for you to do your job. At the end of the day, people who become clinicians, it's altruistic. They're doing it because they really care. They want to help people. So whatever we can do to unblock them from the admin, the overhead, how they get paid, all of the billing, and just make their lives much easier so they can just focus on taking care of people. Well, it's a win-win, right? We're bringing them business. We're a distribution channel for them. We're building technology that allows them to scale themselves. We take care of them. We've built a community where they can connect with others, where especially as a therapist who's typically in private practice, it can be quite an isolating job. We connect them and build a community around it. So now we've got this network effect where people are getting business, they're getting paid well, they get free technology so that they can be more efficient and scale themselves. And now they've got a community to connect with others. And this has allowed us to have a really, really sticky network with our providers.